Shillong now is getting hotter. We now need some coolers. We need some fans. Otherwise, even 5 years ago also it's not this hot. But nowadays it's getting hotter by the day. Yeah, yes.
Population and vehicle.
Yeah, that is also there. Yeah, of course. Guwahati too must be crazy,
What is crazy? 20 years ago when I was coming here, it was altogether different.
Mm-hmm.
The ambience and the greeneries, and now everywhere it is construction, and now it's become just a building block, nothing else.
True.
Concrete city.
I couldn't agree more, because there are a lot of these spaces even in our localities also, because again of people coming again from rural areas and they're building up, and population also is getting
tourism is
bigger.
good up to a certain extent. When it crosses the limit, and the government should limit the number of cars coming per day. That should limit, because all other hill stations, they are getting spoiled for this unregulated tourist activity.
True.
Tourist activity should be regulated. People should have just online permission for one car and how many person just 2 months before or 1 month ago. And only that car should have been allowed inside. The per day, that much of car should come and that much of car should go out.
Yeah, at least that will really help.
That will help, really help.
Yeah. All right. A very good evening, ladies and gentlemen, or morning if you're watching this early in the morning, and a very good afternoon if you're watching late afternoon. I am Fernand Rani, and we're here with another episode of the podcast, Ha Shillong podcast, Talk of the Town. Ngidan hangni hakani ka klimat hangni hakoi pat ke episode dakawai pat ke episode dakawai pat ke rukam jungya keren. We have had doctor before here. We were talking about a lot of things, but today he's back with us to enlighten us a little bit more about a few things that we will be discussing later. But then first off, thank you so much, doctor, for your time here, and also for the interest that you show with regards to the show and also the people. Because we tend to have a lot of if not less of information, but actually more of the misinformation, because it's like the internet or Google is like the go-to space, or the first thing that we would go to, and then Google things about even a sickness or so, and rarely that we would go to a doctor and see a doctor. We would go see a doctor until and unless we find a solution. It's there. So it's more like we try to find solution by ourselves first on the internet, and then if we couldn't find it anymore, if we couldn't find the explanation, then we go and consult a doctor.
You are 100% correct. And see, people has the right to research.
Right.
Whatever they have their complete right.
Yes.
But the problem is that internet and Google and all this AI,
yes,
they will give you information.
Exactly.
And information is not knowledge. That I must acknowledge.
True.
And for information to convert it to a justified knowledge, it needs you to go to a physician or a nearby doctor.
Yes.
And
true.
Just talk with him, just convey your concerns, and then take decision. But if you go on Googling and seeing all this AI and Meta, then overnight you will become a little bit of psychiatric person. Because initially 2 or 3 search will show, yes, infection, stone and this.
Yes.
Suddenly you see that some cancer will come in your screen.
And then you'll have panic.
And the panic, then the whole night you will be in a very different mood, and in the morning you will go somewhere.
Right.
And once that sort of things come into your mind, it's very difficult to make yourself calm.
True. And we ultimately go and consult, or even get ourselves into the wrong place.
Yes.
Of trying to of not trusting the doctors anymore, because what you see on the internet is completely different from what the doctor is saying.
Nowadays, over treatment is a problem rather than under treatment. So nowadays, because all of this Meta and AI and Googling, over treatment is more common.
And also
Over investigation and over treatment.
right, and over the counter medicine and stuff like that. Also, it's like, I mean, it's not regulated. It's not prescribed by a by a doctor or a practitioner. That way, they just go and get it. Sometimes the medicine is not even meant for you.
Yes, you are right. So one very humble suggestion for your viewers that yes, research is good, and you have every right to look for what you are having a problem. Have a first-hand knowledge,
Right.
but don't Google too much and don't search AI and all these things too much, because then it will cause a problem in your brain. Because brain is a very complex thing, and once it catch up something, yes, some cancerous it may be there, somewhere it is written, then everything will move around the cancer and cancer. You are thinking that you have a cancer. Sometimes a
Yes.
small amount of blood in the urine, and you will don't think about infection or stone. Directly you will connect it to the cancer, because you have seen somewhere and Google somewhere has written, yes, cancer can cause blood in urine. And then whole 1 month you will run around one
Right.
doctor to another doctor, have lots of CT scan, MRI, and after that everything will be spoiled. So that is a tension and anxiety. The cost of anxiety and tension is much more than what you are actually having. You might be having a very small issue.
True, doctor.
So
I mean,
unnecessary treatment and all these things are making us
I couldn't
very,
agree
very
more.
problematic nowadays. Yeah.
It is good that we start with that, because there are a lot of people. I mean, even for myself, if I face anything at all, at least, okay, I will tell my wife first, okay, this happened to me. And then I'll go to at least to the internet and search for why, I mean, what could be the possible cause of this. And then if I'm not satisfied with the answer, and then I go see a doctor. Otherwise, if it's something which is, which is normal, some like a bleeding nose or something when you have a fever and something like that, so I tend not to go to a doctor. But if it's something severe, something severe like a stomachache, which you're not sure if it's a gas or not, so then I would go to a doctor. Otherwise, a good research can also help, like you said, because home remedies and all that are also there.
Yes, see, God has made all of the mankind, and our body has its own power to
Right.
get rid of some of the common problems which we have.
Yes.
Suppose in common cold. In common cold, we know that it will go off within 6 or 7 days.
Yes,
Whatever
yes.
will you take, antibiotics or antihistaminics, whatever you take,
Right.
common cold will stay for 5 to 7 days.
Yeah.
But you will have a little bit of less problem if you take medicines. But nobody, it is viral, nobody can take it away from you. Once you have a common cold or some viral fever, it will stay for few days.
Yes, exactly.
Okay.
And it is contagious also.
Yeah, and our body will fight it out.
Oh yes.
Our
yes,
immunity will fight it out. So for every problem, our body will try to just find a problem, a solution for that. And then, such as example, if a small stone comes from the kidney and stuck in the ureter, that means urine pipe, immediately the patient or the person will have excruciating pain, will just have a crying and all these things, because without injection that much of pain is not have any solution. He has to go to a hospital, have injection, and after CT or after ultrasound, you see there is a small stone just stuck in the ureter, 6 mm or 5 mm stone. This is the time we should take a little bit of caution, because whatever happens, all the hospitals and this nowadays, little bit of predators nowadays. So if you don't have any fever or something like this, it's better to give time for 10 days minimum. Within 10 to 12 days, our own body tries to expel that stone out of your body, small stone.
Okay.
But within 2 weeks, the kidney will not have any damage. Just believe me.
Oh.
But if it may be that you might have to take 1 or 2 injections or 1 injections per day to get rid of that pain, because the pain is very severe. Sometimes there is vomiting. There are many of your viewers might have that type of problem. But it's not the time to get admitted. Don't get admitted, and just wait for 1 week or 2 weeks. Just have a CT scan after 1 or 2 weeks, non-contrast CT, and have a look whether that stone has passed it or not. Most of the time, 90% of the time, the stone will pass out automatically, spontaneously. That our body will help it out. And there is no medicine on earth to dissolve a stone or to take a stone out of your body. Just believe me. There is no medicine on earth. So all these are a little bit of fictitious things. Only 1 or 2 stones that might dissolve. That is 15% uric acid stones sometimes work. Other stones which are more commonly available, oxalate stones or phosphate stones, they are not amenable to any type of medical treatment.
All right.
So that's a false impression people are getting that I have a stone 2 centimeter or 1 centimeter, I am taking medicine and the stone will get dissolved. And so these are false impressions. The patient is taking 2 or 3 years taking medicines. After that, he will develop some sort of gastritis because of the stone medicines. Now, at the end, after 2 years, the stone will get from 2 centimeter to 3 centimeter, and the kidney will also get damaged.
That's why.
So these are again misadventation and misinformation.
Misinformation. Exactly.
Yeah.
That's why proper consultation is very important.
So the moot point here is if the stone is small in the kidney, if the stone comes out and stuck in the ureter, that means the road passage of the kidney, there will be excruciating pain, vomiting, wait, go to a nearby hospital or clinic, get yourself injected with some analgesic painkillers, take a rest, half an hour, 1 hour, and come to your home. It might be that 2 or 3 days, it might have to take a painkiller or antacid and injectable painkillers. And after 5, 6 or after 10 days, the stone will automatically come out. This is one situation. If you see that after 10 days or after 2 weeks also, the stone is stuck in the same area and your kidney is little bit swollen, it is the time to intervene. And at that time, we usually use laser to take that stone out.
All right, that's a lot of information.
Yes.
So I can only conclude it with this, that you cannot find all this information on the internet. It is only when you consult a doctor, consult a specialist that can help you. So I would just okay. So what we will be talking about today, I hope it's all about stones and kidney stones and all of these problems that a lot of us in the community are facing. Because again, sickness like these, you can't just Google. You of course, I mean it's something that people are familiar of, but yet I think the condition will differ from one person to another. So today we'll be talking a lot deeper on how you can take care of yourself, especially when you are facing or you're going through these kind of situations and pain and sickness, when that has to do with your kidney and the stones, the kidney stones. So, doctor, can you please introduce yourself for viewers out there?
I am sorry to say this. I am Dr. Narayan Chakraborty. I should have told it earlier only.
It's okay.
It's 8 months almost, though we have completed our earlier episode that was on prostate. So I am Dr. Narayan Chakraborty. I am from Gauhati Urology Center, that is in GS Road, Christian Basti, just by the side of the Apollo Hospital. So I worked many years, 25 years almost, in several corporate hospitals. Now I have my own center. It's a big clinic and it's a comprehensive clinic having all types of facilities. But I perform surgeries all over Guwahati in most of the big hospitals. So not all of my patients can afford a bigger corporate hospital. So for them, smaller hospitals or Ayushman also can be arranged for them. So that's why I have opened my center for 3 years now. But I am also going to bigger hospitals such as Health City, Hayat Hospital, Apollo Hospital, and all this. But I see patients at my own clinic, that is Gauhati Urology Center, and that's for the patient's benefit. So there is no compulsion for me to operate in a single hospital only, or to get away with the Ayushman cases, because many patients can't afford and they should have availed the Ayushman facility nowadays given by the government. Yeah.
All right, all right. So, but yeah, I just wanted to ask: are you also visiting Shillong lately, or
No, long back I was visiting Shillong. That was in Bethany Hospital. It's almost 15 years ago.
okay?
But not now. But I am concentrating in my own, because 40% to 50% of my patients are coming from Shillong and all around the Garo Hills and Kashi Hills,
I see.
because this is the most stone bearing and stone forming areas. One of the highest stone forming areas in Northeast,
Is
Manipur
it?
and Meghalaya.
Is it?
Manipur and Meghalaya, and third comes the Arunachal Pradesh. So these are the stone forming zones in Northeast. Even
I mean, if I can ask why, doctor?
so, see, there are few factors, not only a single factor. It is multifactorial. First factor is that the food habit, cultural
Okay.
food habit. The food is related to the culture.
Right.
Now, excess red meat intake, so that is one cause. Second, less fluid intake, water intake, that is another cause. Third, the water, what some of the geographical area people take, the water is not so good as in other, because it's not the sometimes not the from the river water. It's from the groundwater.
Groundwater, yes.
Groundwater is sometimes cause
of
having
chemicals
more
and all that.
chemicals and all these things, more salts. So this can cause. And the persons who are working in hot and humid climates, they are having the stones. But northeast and this beetle and all these things, they have also some effect on the stone formation. But the main factor, exact factor nobody knows, but the main factor which I presume is the high non-veg intake. High
see.
non-veg intake, that's causing the more problem here in northeast states. Specifically, to be more specific, it's red meat. So we need to moderate the red meat intake, because it's the part of the culture. So we shouldn't stop it. We should moderate it.
So, doctor, if you can help us, explain or make us understand what are actually kidney stones and why are they so painful?
See, kidney stones, these are the small crystals formed inside the whatever we take. Suppose a high protein intake, such as red meat or oxalate, heavy kiwi fruits or something. Some fruits also have the high oxalate intake, and meat also. So all these elements, non-veg elements, and some fruits also, the constituents of these non-veg and fruits, they are get metabolized in our body by the liver first,
Okay.
and then these are the bad things from the body, and they get expelled from our body through the kidneys. So kidney works like a sieve, net. So in the process of expelling the bad elements from our body through the urine, these small crystals, they got deposited in our kidneys, and these crystals are oxalate crystals and phosphate crystals. So these are maximally found in red meat and some fruits such as
Okay.
strawberry, tomato, and these kiwi fruits. So these are the fruits also, they also cause. So too much consumption of certain amount of fruits or too much consumption of red meat is causing these small particles or crystals to get deposited in the kidney, and they get deposited in the renal papilla. There is one small in the lining of the kidney. There are small crystals deposited, and one crystal after another, one crystal after another. In that way, a small 3 or 4 stone get formed. Now,
Okay.
pain will not happen till the crystal clump of the crystal get attached to the kidney lining. Once the kidney lining, the stone weight increases, crystal weight, these crystals get dislodged.
Okay.
They get dislodged from the kidney lining, and they fall in the path of the
The,
urine. That is called the ureter. Ureter is the pipe which drains urine from the kidney to our urinary bladder. So once the stone get dislodged from the kidney, clump of crystal is called stone.
All right.
And this stone, small stone, come and get deposited in the ureter. That is blocking the ureter. At the same time, you will have severe pain. The pain is good for a patient because pain indicates that our kidney is trying hard to push that stone out of our body on its own. So that's a boon in disguise. But we have a severe pain out of that.
All right. So does that happen to everyone who is facing kidney stone problems initially, or
No, not initially. 80% of the people don't, 20% of people don't have any problem. Because sometimes the stone is very smooth, or sometimes the stone is very small, so that it get expelled without having any attention from the patient.
Okay.
So sometimes they don't know. And there are many patients who are habitual stone passers. They know that yes, I have little bit of pain and I will pass stone within 1 day or 2 days. There are many patients like this. Out of your viewers, I think many viewers are like that who will experience that. They feel that a little bit of pain. I'm going to pass a stone with a day or 2. They come to know. But sometimes many people are unfortunate when stone don't expel on its own and it gets stuck. So continuous pain, and at that time it needs surgery. Surgery means not open surgery. It's just ureteroscopy, flexible ureteroscopy from your normal urine passage. Break the stone with laser and give him relief, so that the path from the kidney to the ureter is again established. So
Yeah. So, but and I've also seen some of. There are some who experience it just once, but there are some who who has frequent stone problems.
yes,
What could be the reason or the
you are
difference
right.
between the two?
So I must say that a person who is having one stone formation in one kidney,
Yeah.
the recurrence stone formation is 50% in 5 years. That means if you have a stone in your left kidney, if I remove the stone also, there is no guarantee that another stone will form in the same kidney within 5 years. 50% out of 100 people, 50 people will have another stone within 5 years. But how big will be the stone? It's not so. It's usually we just advise the person who is having a stone problem to have some dietary restrictions. We give a dietary chart, more water, what diet to avoid and what diet to take, and then have one ultrasound every 6 months to see whether if there is any stone 2 mm or 3 mm or 5 mm, whether the stone is increasing or not. That's all.
So if you say that it has a lot to do with the food habits and all that.
Yeah.
So according to what you've been practicing all this while, you've come across a lot of patients that way. In the last 5 or 10 years, did you see an increase of people having it, or it has remained the same, or what is the picture
Actually,
like?
I got your point. Actually, it's increasing. And the cause is multifactorial, like I have told. There is more meat intake nowadays than before. And along with meat, nowadays, the processing of the meat is being different because fast food stalls are coming out. People are now taking meat not in our normal form, which were made in our kitchen. Now people are taking meat in the form of fast food. So meat along with fast food, so that makes the things more difficult and clumsy. Now, so the incidence of stone formation has also increased.
I see. I see. So now, if that's the case, is there any chances that kidney stones are hereditary, or?
Yeah, there are only few. It is 2 to 3% cases. It may be hereditary, but in most of the cases, it is the geographical location of the patient, food habit, and the climate. All these are responsible for a stone.
Okay, then does that mean that people who has kidney stones are grown-ups and adults, or do you see that in much younger age too?
Yeah, previously, that's a very good question you have asked. Previously, we used to get stones only in adults. Nowadays, in younger child also, we are getting stones. Because in younger child previously used to have stones, only genetic stones used to have. They used to have genetic stones. Nowadays, it is the lifestyle changes in younger people also, which have caused more stone formation in younger. Even 5 year, 6 year, even 3 year boy or girl, they are coming with stone.
Can we
The
see it's
cause
because
is
of the
that
junk
they are
foods and all
taking
that?
too much of junk foods. In each and every house, the food habit has changed a lot since last 20 years.
Interesting.
Yeah.
Very interesting. So, which means now, so if that's the case, I mean, how different is it between an adult and a child getting it? I mean, what are the risks of getting it, and also when it comes to the treatment, is it different, or and how frequent would that child? Suppose if a child gets it, how frequent would, or the chances that he would get it again or she would get it again?
Yeah, in child we are more cautious because if a person of 50 years having a stone, he has to live another 30 or 40 years. If a child of 10 years have to have stone, he has to live another 70 years.
Right.
So our attitude to a small child who is having stone is much more aggressive, because we then send the patient for metabolic information. Is there any metabolic cause in the blood, any problem in the blood, or any genetic factors? So we have to exclude all this for a child, as well as we need to talk with the parents, what type of food habit have or she is having, the small child. Because for kidney stones or for ureteric stone, whatever stone, there is a limit of intervention. Intervention means in the form of endosurgery, laser, or something like that. We cannot perform limitless laser surgery or endoscopic surgery for a patient throughout his life. So if a small child, so prevention is more important than for a operation.
Right.
And for adult also, that is important. So let me come to a very interesting point. Some people have that they have done an ultrasound for a different cause. So the doctor has, just a physician asked a person that you get your ultrasound done. In the ultrasound, the whole abdomen, they have done the ultrasound kidney also.
Okay.
And in the ultrasound kidney, the sonologist, the radiologist has found that 2 mm or 5 mm stone is there in the kidneys. The moment the person got the report, he get agitated, anxiety, and all these things. Yeah, doc, I have kidney stones in both of my kidneys or one of my kidneys, and it is shown in the ultrasound. My humble advice is to not to get worried about all these reports, because in most of the cases, small stones, 5 mm, 4 mm, which were picked up by ultrasound, these are not actually stones. And if we do a non-contrast CT, plain CT, most of the stones are not visible. So these are not actually stones, and most of the time the sonologist, radiologist who has done he has done a mistake. It's not mistake also, it's very difficult to identify very small stones. So they write that one or small stones is there because echogenic factors. Ultrasound is not to be relied in case of kidney stone diagnosis.
So
once a ultrasound tell that you have a small stone or 2 or 3 stones in the kidney, immediately our advice is to get one non-contrast CT scan, that is plain CT scan, do and see whether the stone are actually there or not, or you are just taking anxiety and taking medicine on your own.
Okay.
If the CT scan shows that yes, you are actually having a stone 5 mm, 6 mm in both kidneys, but these are not blocking the urine passage, there is no treatment at all. Just dietary advice, take water, more water, and relax. Because these stones are not going to cause any kidney damage in near or distant future. Okay? There is no medicine should be taken. Some people are taking potassium citrate, and there are many companies which are in all the big companies they are having potassium citrate, K-citrate or potrate and all these things. So these will not dissolve a stone, and these, if you take 2 years also, the stone will remain the same. And ultimately what will happen, this potassium citrate, this cause gastric irritation. And after 1 year, the stone will not get resolved.
But you're getting another sickness.
But you will definitely land up before a gastroenterologist. Yeah, doc, I have a kidney stone also. Now I have gastric problems. So this is the problem which is happening. So this is because of misinformation. So just
Right.
more water. There should not be any treatment. If you don't have any symptoms, don't get treated. Another set of patients came. They are having, suppose 50 years or 45 years. They are having back pain. The pain in the back. That may be due to muscle spasm or osteoarthritis. Sometimes backache happens due to many causes. In the spine, there may be cause. And a doctor has asked, okay, you might have a stone. So backache with ultrasound, he rushed, yes, doctor, I have a backache and I have stone in both kidneys or one kidney, 5 mm or 6 mm. It is very difficult to make him understand that, yes, you have stone, I understand, but that stone is not causing any backache.
Okay.
But he has, as you have already said, Google and all these things, mobilized him in that channel
Direction.
that will get that stone operated without any cause. That stone don't need any surgery. You are having, might have a backache because bike, excessive use of motorcycles, or you might be busy in a occupation which needs you long time standing or long time sitting posture. So your posture is causing problem for you, and that should be treated by a physiotherapist or a orthopedician. Your kidney stone may be small, 5 mm or 6 mm, but that doesn't need any type of medicine or operation. Just get it cleared.
Okay. Now, I just remember one thing. I mean, I've heard this somewhere that salt can also contribute to kidney stones. Is it right or wrong?
Yes,
or?
too much of sodium can cause kidney stone. Sodium intake.
All right.
Too much of sodium intake. Citrate is a reliever. That means lemon. Lemon is good for your kidney stones. It is have a preventive aspect. So more citrate is a good thing. Another misinformation is that since kidney stones have calcium phosphate, calcium oxalate, so you should not take calcium. So that is another misconception among people. If you reduce your calcium intake in the body, or if you are aged, around 60 years or 55 years, you have osteoporosis. If you stop taking calcium, more calcium will be formed in your urine. So there will be more stone formation. So the less calcium you take, the more stone former you become. So that's a complete misunderstanding. So people think that I have a calcium oxalate stone and all these things, I should not take calcium. That is a completely misconception. You should take the normal amount of calcium you take. If possible, moderation for necessary for sodium. Sodium is responsible,
Okay.
but not calcium. Calcium normal, citrate normal. Lemon is good for your health. And moderation on red meat intake. Take red meat, but little bit less. Yeah.
So I mean, okay. You said, you mentioned about junk foods and all that. Now, if I can be a little more specific, let's just say coffee intake or soft drinks or protein shakes or all those things. Do they also contribute? Or
Yeah, all fizzy drinks have oxalate. All fizzy drinks. I means
yeah,
it includes all the
soda
fizzy
and all
drinks.
that.
Yes, you have oxalate, Coke and all these things. Okay, so the more oxalate is bad.
Okay.
And junk foods are also bad for the same reason, because it's bad for the heart as well as for the kidneys. Because all the bad oils, they get filtered by the kidney and liver. So fatty liver and kidney problems, all these happen.
So if that's the case, then is there a relationship between obesity, diabetes, and kidney stone?
Yeah, definitely. Obesity, diabetes nowadays, previously some 30 years, 40 years before, we are of the opinion that yes, if a father and parents have diabetes, a son or daughter have chances of having diabetes because it's genetic. Nowadays, you think that it is a lifestyle disease. metabolic disorder. So nowadays the obesity, diabetes, hypertension, all these things are metabolic disorder. Uric acid. Most of the people are having a high uric acid level. So these are metabolic lifestyle changes. These are lifestyle disorders. That means the disorders which the person has brought in his life by not having too much movement, sitting posture, and all these things, not taking good amount of food or healthy food. So all these things are lifestyle problems, as well as anxiety, sleep disorder. So all these things are adding up one after another, and ultimately diabetes, hypertension, obesity, this come, and kidney stone will form definitely in these patients. Not only kidney stone, many problems will come up.
There is a saying. I mean, I don't remember where I heard this from, but I must have heard this from somewhere. It's there in my mind till now, where people saying that, okay, if you have kidney stones, you take a beer and it can flush it out. Is it true?
It's not completely true, but half truth. Half truth.
Okay.
But it works only when a stone, as I've already told, when a stone is stuck in the ureter.
Right.
Then what will happen? How the stone will come down and get out of your body. So it is the weight of the urine. There is a column of urine, and weight of the urine is pushing the stone along the tube.
All right.
Okay.
All right.
So what the drink will cause? Drink is every drink, not only beer. Every alcohol is a diuretic. Diuretic means it causes more urine formation by the kidneys.
Okay.
Any person you take 2 or 3 packs of drink and he will go to the loo for 3 or 4 times. Okay, so that means that his kidney is forming more water. So in that way, the kidney forms more water after taking 1 or 2 mugs of beer, and it helps the stone to come down.
Okay.
But that doesn't mean that he has to take beer 3 or 4 packs daily. Morning 4 packs and evening 4 packs. It's not like that.
Right.
So it's half truth. Water also do the same thing.
Otherwise,
Anyway.
our mothers and all start drinking beer. Then okay. Now it makes sense.
Talking about those oil, you were saying, doctor. So is there any effect about cooking oil? The difference between like mustard oil or refined or olive oil?
Yeah, see, that was a very good question. Previously, we used to think that mustard oil is very bad. Yeah. And in Northeast states, mustard oil is as a primary use.
Yeah.
One thing you know that mustard oil is banned in UK and European countries. It's not regarded as an edible oil, mustard oil.
Oh.
But in India, mustard oil is edible. In UK, you will not find mustard oil as edible oil. Okay. So mustard oil is good for heart. For so long, people used to teach us the mustard oil is bad for everything, but mustard oil is good, and many people are living 90 years and more after taking mustard oil.
Yeah, of course, our grandparents survived with mustard oil.
Because mustard oil is a very good activity.
Okay.
And mustard oil just covers the pungent smell of all this meat and fish. It covers up mustard oil. So mustard oil is good to cover up the original smell of fish and meat. So that is good. If you go to South India, they are using culturally coconut oil. People used to say that coconut oil is very bad. But see, 100-year-old farmers are working in the field. They are taking coconut oil all throughout their life. So it's a very, some people coming up with the idea that yes, if we tell something bad about whatever you are consuming, then you stop consuming that, or it will take up someone. So there are some industrial sponsors in promoting all these misconceptions. I don't think it's true. So yes, there are many. After that, this groundnut oil came, and this palm oil came. So all these things are, it was just an industrial action to just say that our mustard oil is bad or coconut oil is bad and promote our oil. It's not like that. But definitely olive oil has got many good ingredients for our heart. Olive oil. Yeah.
I see. Now, speaking of these early detection of kidney stones, I mean, what are the symptoms that are very visible to a patient? That they need to take care like immediately when something like that happens.
See, 80% of the people will have, if they have kidney stones, they don't know themselves they have kidney stones. There are many people who are walking around you meet on your daily life.
It could be
If you get
myself
ultrasound,
also.
myself also. If you get yourself ultrasound, you might get 1 or 2 kidney stones inside your kidney. That is not causing your problem. The problem starts the day you get to know that yes, I have a stone, and then you see the Google. So all these things comes after knowing that you are having a stone. Otherwise, in 80% people have stones, but they don't know. The second, once there is a stone, it comes down and stuck in the ureter, as I have already told. These are called ureteric colic. So they are good people because they are fortunate enough that they know that I have a pain and I had to do a CT or ultrasound and get to know where is the stone located and how big is the stone and how hard is the stone, that need any treatment or not, or any intervention or not. If the stone is small, it will get passed out, wait 1 week or 2 weeks. If not, if the persistent pain, then get the stone removed by a urologist, your nearby urologist. Okay? But don't get too much anxious. 2 weeks wait will not damage your kidney. But if you sit like that and don't do any ultrasound further or further CT and you think that you have passed the stone, sometimes it also happens that we think that our stone has got passed, but patient comes after 8 months, after 1 year with a big swelling in the kidney because water couldn't pass and the kidney has swollen and it becomes non-functioning. So after 2 weeks, it is utmost necessary to get an ultrasound or to get a CT scan done to see what is the condition of the kidney. If there is a mild swelling in the kidney and the stone is still there, it is better to take it out after 2 to 3 weeks. But 2 to 3 weeks, within 2 to 3 weeks, the kidney will not get damaged at all. But however, there are some indications such as with pain, if you have fever, signs of infection, if you have single kidney, suppose you have only one kidney, from other reason some other kidney has been lost, one kidney, then you should not wait. We have to take the stone out and put a stent because he is living on one kidney only. Or if he is having a urosepsis, septic condition with stone formation, then it is utmost necessary to put a stent initially to bypass the stone. And yeah.
Just while you're mentioning regarding the other types of say sickness that a kidney already has, so now how likely does the stone formation can happen with an already infected kidney?
See, stone formation, already there are some 2 types of stone, kidney infections with stone.
All right.
If a stone is stuck in the ureter, that means in the kidney passage, and if the water, if the urine which is stuck above the blocked stone, so if that urine gets infected, then it's a infected hydronephrosis, we call it. So the patient will run a high temperature with shivering and chill. So that's a very bad sign for a patient. If any patient with stone have that, it is an emergency and he should consult a nearby doctor or hospital. At least not to operate for the time being, but put a stent inside. That means bypass the stone and drain the kidney because the kidney is blocked.
Okay.
And the infection happened above the stone in a blocked kidney, and that is a dangerous condition. That is the condition we called urosepsis. Okay.
All right.
Second situation is that sometimes some stones happens due to stone. Yeah, due to infection. That is all called infection stones. These are called struvite stones, calcium, magnesium, phosphate. Suppose the patient is having a recurrent kidney infection or urinary tract infection. So then he can or she can form a big stone inside the kidney. These are actually large stones. We call it staghorn stones, 3 centimeter, 4 centimeter or 5 centimeter stones. So this type of stones are called staghorn stones or infection stones. So this type of stones, large stones in the kidney, will never pass out on its own. Even if a stone size is more than 1 centimeter, in 90% or 99% time it needs surgical intervention, either in the form of RIRS or in the form of PCNL. So if a stone is more than 1 centimeter, don't wait, don't take any type of medicine. There is no medicine of the stone, as I have already told. Consult your urologist or all urologists across India and the world. We maintain a certain ethics and guidelines. So according to the guideline, whatever surgery or whatever intervention is necessary, your urologist will do that. He will not deviate from the guideline. We maintain a standard guideline. So if the stone is more than 2 centimeter, it is better to puncture the kidney with a small hole and take the stone out after breaking with a laser. So that is called mini PCNL, percutaneous nephrolithotripsy. But if the stone is less than 2 centimeter or less than 1.5 centimeter, and then it is possible to break the stone through our urine passage. That is called flexible ureteroscopy or RIRS, retrograde intrarenal surgery. But in that case also, laser is used. But don't wait. If a stone is more than 1 centimeter, by just hearing to somebody that yes, that can be dissolved with medicine and all these are usually misconception. And I just humble advice to all of your viewers not to wait if the stone is more than 1 centimeter. Yeah.
So can is it possible that kidney stone can damage the kidney permanently?
Yes, why not? As I have already told, if a stone is 5 or 6 millimeter or maximum 7 millimeter and it is stuck in the kidney passage, kidney passage is called ureter, then we should give time 2 weeks. If within 2 weeks or 3 weeks the stone doesn't come down and does not pass on its own and it is blocking the kidney, then the kidney will start swelling up. Okay? And because the urine cannot come on that side. The other kidney is functioning, but on that side the kidney is blocked. And the urine get pent up inside and giving pressure and pressure. And then with pressure necrosis, the kidney will stop functioning after 1 month or after 1.5 months. So this is the result of a long-standing impacted stone. We call it impacted stone. So in that way, it can damage the kidney. The second way a stone can damage the kidney is that, yes, initially there was some pain. He took some antibiotics or painkillers and he thought that his stone has got passed. After that, there was no pain, never. After 8 months or after 1 year, suddenly there was a diagnosis that the kidney has swollen up and the kidney tissues has become very, very thin. So at that time, it is there was no other way rather than to take out the whole damaged kidney. Yeah. So one should be very, very cautious if you have a kidney stone.
Okay. So I mean, from the list of people and patients that you've come across, that you've treated also, what's like some of the biggest misconception of a kidney stone that you have heard?
Yeah, the misconception biggest is that, and people are also using that misconception for their benefit, is that kidney stone can be dissolved or kidney stone can be taken out from your body by giving medicine. These are completely false statements. And I must admit that, yes, few people are using that misconception for the, because our tendency is to hear from a doctor what I think. Yeah. If I think that, yes, this doctor is telling what I think, then that doctor is right. If a doctor is saying that, yes, what I am thinking, the doctor is talking just opposite, then I have a question mark on that doctor. Yes. So you see Google. My humble advice is to use your brain. Everybody has got God has given our common sense. So use your common sense rather than listening to many people. Yeah.
Yeah. So again, from the list of people that you've come across or treated, what were like if I can just put it like the worst case that you have treated that has proven successful. Where I mean, a person who has gone through so much pain and so much of the condition. The kidney condition or the kidney stone condition that surpasses the surgery or the treatment so far.
See, I have done surgery, few thousand. It's more than 12,000 kidney stone surgeries I have performed throughout my years, last 25 years. More than 12,000. And of late, I am also avoiding many stone surgeries. Because previously people used to operate left and right. Nowadays I am seeing that most of the small kidney stones, they are not causing any problem, and there is no indication in any book or any guideline to operate on these small stones. So it is better to leave these stones usually. Even if I have a small stones in both kidneys, small and not causing any problem to me. So it is justified that I should keep all these stones inside. Because this small stone, the next question comes from the patient is that, yes, doctor, I have both kidney have 5 mm, 6 mm stones. Doesn't all these stones need treatment? But there is no medical treatment, and surgery is also not necessary for these small stones. It is better to leave them alone. Because only you came to know after ultrasound. Before that you didn't have any idea that you have stone. So these stones should be left alone, no treatment, just dietary advice and take water. In most of the cases, these stones don't cause any problem during your lifetime. But in small percentage, one or small stones may come up from above and stuck in the ureter, causing excruciating pain. At that time, we can take care of that. But as of now, no treatment is necessary for the small stones which are in the kidney tissue, not blocking the ureter. So these stones don't need any type of surgery or any medicine or any other things. Only dietary treatment, take more water, moderation in meat intake. That's all. But if a stone is more than 1 centimeter, as I have already told, it's better to get it cleared. Because this stone is going to give you problem.
So among all these tens of thousands of surgery that you've had, like I mentioned earlier, is there any case that quite different, that stand out from the rest, or maybe the biggest stone that you've encountered on the kidney, and what could be the size and what was the story behind?
The largest stone I have removed is around 9 centimeter. It's a cumulative stone diameter, that is called 9 centimeter stone, and that I have opened. Because many patients came. See, there are in guidelines are all Western guidelines. In Western guidelines, it is said that even if a stone is very large, we make 2 PCNL, 2 drills inside the kidney or 3 drills. Or even if it is not possible to make it clear by 1 drill or 2 drill, then stage the patient. After 1 month, again call the patient and do. But how many patients in our country will want to do that type of surgery? 2 stage, 3 stage. So it is better to do a open surgery and get the stone cleared in a single go.
Okay.
So in poor patients, that's a open surgery still we are doing, but in very, very few, 1 or 2 patients per 100 patients.
So which means open surgery are not really advisable, you mean to say?
Open surgery is not advisable. It's a very, what I think, it's a blunt statement. In poor country, in countries like us, PCNL and all these things will cause some amount of money, because not all hospitals, and in government hospitals there is a long list. If a patient have a big stone and kidney is getting damaged day by day, so it is better to take that stone out, the whole stone. If a stone is very big, get the stone out in a single go with a small incision. The cut is very small and put a stent and make him stone free in one go, in one sitting, rather than making him PCNL or RIRS in a multiple sittings.
All right.
Okay? Because we have to see their socioeconomic condition also. Yeah.
Okay, then so in such cases, how does one lead a healthy lifestyle after this surgery or after getting rid of the stones?
Usually after removing a stone which is blocking the kidney function little bit improves. But not all kidney function improves. Suppose if a kidney loss 30% or 40% of its function, only 5% or 3% function will be recovered. But whatever is lost, that will be lost forever. If a kidney function has lost 30% due to a stone or due to negligence that he has not, but the kidney function will not return again. And there is no medicine on earth to make that kidney function return again.
So that also brings me to this question. Now, if something like that happens, what are the kind of infection that a kidney usually get?
It's a combination of, once a stone is there is pent up pressure as well as infection. So kidney is damaged due to the pressure and infection both. So it is a bidirectional attack on the kidney. Stone is a secondary one. Stone is blocking the kidney and kidney is getting damaged by pressure because pressure is built up inside. Urine cannot go. And second is infection. So both things are damaging the kidney.
So they have to be extra cautious after
this. Yeah. They should avoid all this dietary advice and everything.
After going through, let's say, these if not surgery but this treatment and all that, if let's say if I have a stone in one kidney, now is there any chances that I can develop on the other ones also, or
usually it's less. It is not so.
All right.
What our experience is that if a single kidney, left kidney or right kidney, whichever has got one stone, that kidney repeatedly having stone formation on the same side, not on the other side. Usually, that is the usual feature. Yeah.
Okay. Now, for a kidney, for a healthy kidney, so to say, how can one, or maybe I'll just put it this way: what are the kind of sickness that a kidney usually has or faces? Apart from the kidney stones.
Even if a kidney stone damage one kidney completely, if the other kidney is normal, then the patient will not have any problem. We come across many patients who came in the age of 85 or 90 years. But he don't know that he is having big stone and that stone has damaged his one kidney. He is living with one kidney since last 30 years, 40 years, but he didn't know. So one kidney, if it is okay, then what kidney is sufficient to make a patient healthy till his lifetime. So it's not a very big issue. But once you know that you have a stone, it's better to big stone blocking, better to take it out.
Okay. And is there any other sickness? What are the other sickness of a kidney apart from
that? Yeah, there are some patients who are having diabetes also, hypertension, blood pressure also. So diabetes and blood pressure, these are the main causes to damage a kidney medically. These are called medical renal disease. So apart from this is aside the kidney stone problems. Right. Kidney stone damage kidney, I know. And the pathogenesis also I have told you how it damaged the kidney. Yeah. But the other people who have got damaged kidney or CKD, that is called chronic kidney disease. The main cause is diabetes and blood pressure. Uncontrolled diabetes and uncontrolled blood pressure. So these are the lifestyle changes which is causing the kidney damage in most of our people in nowadays real world.
Like you mentioned already, metabolic.
Yes, metabolic causes. So these are the damaging the kidney. It's not that the patient is having a sugar and I am treating the sugar, the kidney will remain good. Or if a patient is blood pressure, blood pressure is 140/90 or 140/100. He's taking medicine irregularly and everything will be go. He will gradually damaging the kidney bit by bit. And in 60 or 70 years, you see that his creatinine and EGFR will rise. Yeah.
So now, when it comes to older people, like you mentioned earlier, I mean, this person who's been living for the past 30 years with just one kidney. I mean, for older people like them, what kind of treatment would you suggest or would you advise for them in worst case scenario?
See, there is evidence that if a person come at the age of 70 or 80 also, ripe old age, but if he is fit enough, then it is better to remove the stone. Because it is already, there is evidence that if there is a stone in older people, but he doesn't know, the stone is smooth and there was no pain so long, 40 years or 30 years.
It's not blocking.
But it is not blocking, but he is having a stone. The stone related death incidence is much more than the natural death. Okay, that means the most likely he will live 10 years less. If the stone is removed, he will live 10 years more. So the stone might cause infection and all these problems. And if that patient at 80 years of age goes into infection or urosepsis because of that stone, his chances of leaving the world is much more than 10 years earlier.
Okay, interesting.
There is evidence, yeah. So we see the fitness, we see the patient as a whole. If he is fit, remove the stone. If he is unfit and have multiple problems, heart problems, diabetes, unfit, he is incapacitating, bedridden, don't do anything. Don't do anything. Okay. That's
Why I ask is that there is a lot of hesitancy also from the patient side of getting themselves treated and all that. But I mean, do you also? Of course, I would imagine you'll be having some sort of counseling and all that for the patient.
Yeah, definitely.
All that. But what could make a person, or why would a person be hesitated, or what are the kind of fears that they usually
people
have?
usually hesitate because of few things. He will hear the word surgery. People are very fond of hearing the word laser, but they have don't idea what is laser. There are many types of laser, but laser is the energy only. Laser is used to break the stone, but it's an operation only.
Okay.
There is no word like a laser operation. The operation name is PCNL, mini park, RIRS, flexible ureteroscopy. These are the name of the operation. It is the energy which break the stone. You can break a stone by a hammer, you can break a stone by bit by a laser also. But there is no word like laser surgery for a stone.
Okay.
So people are just getting swayed away by the word laser. And there are 2 or 3 types of laser. One is good and another is bad. And they don't have any idea about the which laser the doctor is using.
For them.
Fit for. Not all lasers are good for kidney or for ureter. So at different places, we might have to use different types of laser. And sometimes we don't use laser also. We need to use the lithoclast. There is a pneumatic lithoclast to break a big stone. So people are just getting afraid of what the doctor will do. Surgery always means that cutting the belly. It's not like that. Endoscopic surgery is also a surgery.
Yeah.
If you cut the tummy, that is also a surgery.
Right.
So people shouldn't get worried about the doctor has told that surgery has to done, operation has to be done. Till now, the same idea is moving around. That operation means cutting open. It's not like that.
So what's like the hardest cases that you've attended to?
Yeah, that's the open kidney stone surgery, and sometimes bleeding happens in case of very large stones. And we have to drill hole and blood comes out. Sometimes it's very torrential bleeding happens in few people, only less than 0.5% cases. Then we have to do some angioembolization or something like that to stop the bleeding, to keep the kidney intact. So complication happens sometimes, but it's very, very less, 0.5%. RIRS has come up as a new idea, and it's a very good. Less than 2 centimeter we can do RIRS. and we don't have to make a drill. But if the stone is more than 2 centimeter or more than 2 centimeter,
You
it
have
is
to.
better to make a small drill and get the stone out in toto.
Okay.
Yeah.
And what's the recovery period like, doctor? I mean, for a person like that.
If I do a drill on the back and make the stone out, it takes usually 2 days. Not more than 2 days if no complication happens.
Okay.
And if we do perform RIRS, then it's usually 1 day.
All right.
Retrograde. That means through the urine passage and using laser. It's usually 1 day. So it's not a very big issue, but we have to assess the patient. We have to see the CT scan result. How big is the stone? How hard is the stone? We have to see the Hounsfield unit in the CT scan. It is written already.
Okay.
And where it is located. In kidney, there are many places. Usually there are 3 bedrooms in the kidney. In which room it is located, that also matters. Then all these things will, and on-table decision also sometimes happens, alters.
Okay. I mean, have you ever, have to stop an operation midway also?
No, we don't have to stop, but we have to change our plan. Sometimes
Okay.
what I feel that, I have to need to make a hole after putting the patient on table and doing an X-ray.
And realize
Intraoperate, I
something
see
else.
that stone is little bit smaller. Whatever written in the CT is a little bit bigger size, so I can handle it with RIRS. That means flexible ureteroscopy without drilling the kidney, making a hole in the kidney. So in that case, our line of operation has changed.
Okay.
Yes.
All right. And now, so speaking of Shillong as not just Shillong but Meghalaya as a whole. Now, when you said that almost 40% of the patients
Yeah.
comes from here. Now, how would you how would you suggest or advise people when to actually maintain a healthy kidney? Of course, one is the food habit that I can think of, but is there anything else that you would suggest or advise people?
Yeah, I would advise for the new generation is to avoid all these protein powders. These are black and red and all these protein powders. They are just industry driven strategy to sell off all these things. So
Oh.
protein powders are bad for the kidneys. The more you take protein, all the proteins are getting filtered by the kidney, and your kidneys will get, because see, each kidney has 1 million nephron. The unit of a kidney is a nephron. So it's just like a battery. It depends on your use. It's just like a mobile phone. If you use too much, your mobile phone battery will exhaust early. So it's just like the same thing. If you take too much high protein diet, your kidney has to filter off, and your kidney's battery will get discharged very early. So be cautious about that. So you can build up your muscle, you can build up everything and all resistance exercises, but be comfortable not to take added protein other than natural protein. No added protein. Whatever protein is sold in the market, these are damaging your kidneys.
Interesting. Very
Natural
interesting.
protein is much better. There is local hen's egg and chana is there.
Yeah.
All these things. Dal is there.
All right.
Yes.
Now, one thing that I've heard, it could be. I think these are again conversations that we would usually have among people in the family and also in the community regarding the color of the urine. Does that indicate anything about kidney stone or something, or even blood urine? Or
Blood in urine is a different issue. Sometimes very small stones stuck in the ureter passage. Whenever they try to pass on its own, or just after passing, there might be some amount of blood maybe in urine. So that is self-limiting. Small blood in urine comes after the stone has passed, or when the stone is trying to pass, pain and small amount of blood. Otherwise, the kidney remains same colored, straw colored kidney. Normal kidney urine is the straw colored urine or white urine. That more water you take, the more whiter it become. But the amount of water should be moderated also. We think that once we take more water, the kidney will remain good. It's not always like that.
Like how much?
No. That in the other way we should ask how much we need to pee,
Okay.
rather than how much we need to take water.
All right.
In a cool climate in Shillong, you have to make a urine amount of 1.5 liter. If you take 2.5 liters per day, that is sufficient. But if a farmer in Assam or in Bengal, if he is working in the field, farming in the field, cultivation, and under the sun, then to pass 1.5 liters of urine per day, he has to take 3.5 liters water. Have you got the point?
Yes.
So it's not the water, how much water I should take, how much urine I should pass, that should be the question. It's the other way around.
I mean, it largely depends on the environment you live in.
Yes,
and all
yes.
that. Okay.
For 1.5 liter pass urine in a cool climate like Shillong, 2.5 liters or 2 liters is sufficient. Okay? Because another 500 ml will evaporate from your body.
Right.
Yes.
Now, doctor, again, this is out of curiosity. Now, there are a lot of people out there whom I've met and made me also think that, even if I take just a little bit of water after food or while I'm thirsty, where it's too hot and all that, not really like, a routine kind of a consumption, but, I would only take it while, when I am thirsty or, occasionally. It's not really like a routine thing, but it is compensated by the fluids that I take, through my meal, through my tea and all that. So does that, is that a correct information?
Water intake per day, it includes the fluids also. The tea, the coffee, all the fluids you take throughout the day, it also contains water.
All right.
Even the solid food you take, that also contains water to some extent.
Yeah.
Okay. So water intake should be around 2 to 2.5 liters per day. Plus other 1 cup of tea or 1 cup of that juice. That doesn't matter. 100 ml or 150 ml. You add up 3 or 4 cups per day. 500 ml maximum with juice and cup, coffee and all these things. Then another 500 ml that will come out. Okay, but once there is just the patient came to know that I have taken more water or less water, it's the color of the urine. That's a very good indicator. Normal urine should be whitish or just yellow type, light yellow type, straw colored. Once you take less water, suppose you are busy the whole day and you take coffee and tea only and no water and something, or very busy. You go to the loo and you see that your urine becomes red like. It's a high colored urine. So it is the time that you should know that you should take water. Take 2 to 3 glasses of water and urine becomes again white. So this is a good indicator. So color of the urine you should notice.
So if I can just put it this way, like how many times in a day should one pass urine?
Usually it's 3 to 4 times in the daytime. Night time 1 is permissible.
All right. Now I have also seen a lot of in old age people who are having difficulty in controlling urine. Does that also indicate some kind of a problem in the kidney, or
that is not due to the stone problem? That is due to no kidney problem. That is due to the prostate problem they are having, because they are growing prostate size. After 50 years, everybody will have some sort of growth in the prostate size.
Okay.
That just the prostate is not a disease.
All
It's
right.
just like a graying of hair.
Okay.
Okay, so everybody will have some sort of enlargement in the prostate as we aging. It's an aging process, and most of the people get okay with medicine.
But it has nothing to do with the kidney stone.
No, it's nothing to do with the kidney stone.
All right.
Yeah.
Okay. Now, what are some of the things that you wish that people knew already about kidney stone as something very basic that people should know?
See, one should be very cautious about the kidney stone because nowadays the lifestyle changes have come up and this food habit has also changed a lot. So one should be very cautious about they should get their kidney ultrasound at least once in a year and see whether there is any stone. But don't get agitated or anxiety. Once you know that your kidney has got a stone, just get it confirmed by a CT. Actually, whether there is any stone or not, non-contest CT. If the CT shows that there is no stone, just forget about it. Get another ultrasound after 1 year. Okay. Otherwise, it's not a very, very big issue.
All right. Now these. Okay, I have a few questions here regarding regarding these what do you call the place, at least Shillong. I mean, to put it in context for the people of Shillong and the hilly areas around. I'll just take a few. Yeah. Okay. Now something like. Okay. Yes. Now, if someone wants to avail any of these treatment, I mean, should they just go to? I mean, should they consult a specialist, or should they just consult a general doctor for that?
So
or?
if a patient came to know that he has got kidney stone or any stone in the urinary tract or any kidney related issue, he should consult a urologist.
All right.
He will be the right person. There are many urologists in Guwahati as well as in Shillong. There are many places who are there are here in Negrims also. In some other hospital, private hospitals also, you've got a facility of urologist. So get yourself checked by a urologist. It will be better.
Okay. So, what does your center provides?
People can come to my center also. That's not a problem. Everywhere the treatment line and guideline, as I've already told, guideline will be the same. But the way of counseling a patient and to allay their anxiety and fear, that is the main thing. They can come to my place. What we advise is we do not dictate a patient that you should get your kidney stone operated just now, otherwise it will get damaged, all these things. Immediately you need to do. So all these words should be avoided for a patient. Our duty is to give options to a patient, not to dictate to a patient. And to gain their confidence and to make them aware about the facts, about the kidney stones. And make them more aware so that they can take their own decisions, what to do. Rather than dictating them, then get this operated like this, get this operated like that. I will channelize them and just make them more aware so that they can take their own decision. Awareness is much more important than dictating, I think. Yeah.
Right. Now, for someone like who hails from the rural parts and areas of Meghalaya as a whole, who doesn't have access to all this information and all this knowledge, let's say, how would one or how would you simplify the message or even the treatment for that matter when it comes to kidney stones?
A few things I need to summarize here for your audiences. First of all, kidney stone is not always damaging. If you have 5 mm, 6 mm or 7 mm stones in both the kidneys in one kidney, but that kidney stone is sitting in a small pocket, not causing any block, no need of operating on that patient. Get a CT scan done and see whether it is actually stone or ultrasound has got some confused you. So if you have stone 5 mm or 6 mm, just see a urologist and take his opinion. Okay. If you have a ureteric stone and you are having a severe pain, don't get operated immediately. Wait 1 or 2 weeks, see whether the stone will come out on its own or not. If it doesn't come out within 2 weeks, get another CT or ultrasound done and see whether the stone is stuck at the same place, not coming out or not moving. Get the stone removed by URSL, flexible ureteroscopy or semi-rigid ureteroscopy and laser. If you have a stone more than 1 centimeter, 1.5 centimeter in the kidney, get the CT scan done, check whether the stone is actually there, where is the stone, how hard is the stone, and get the stone removed by a small hole in the kidney. So that's the thing we need to know. And most of prevention is more important. Moderation of meat intake, red meat intake is very, very important. Along with more water, more citrus soda. These are good for us, citric acid.
Okay.
Lemon and all this lemon water, these are good for your kidney stones. And just be vigilant so that every 6 months you get an ultrasound and see whether the stone is increasing or there is no another stone formation is there. That's all.
Just one last question, Doctor. I mean, you've mentioned quite a few times regarding water and water intake. I mean, at the very beginning of the conversation, also you did mention regarding the quality of water. Now, there are a few areas here in Meghalaya that do not have access to those river water, so to say, and they have to rely on the groundwater. Now, that is one thing that can actually affect and or maybe cause kidney stone. But is there also a possibility that an unclean water, not filtered water, which is not filtered or not boiled, can actually cause kidney stones?
See, nowadays many filters are coming up, commercially available filters.
Right.
So some of the filters are bad because we need some amount of minerals also in our water for our day-to-day good life. So our water should not be devoid of any filter, any mineral. Some of the filters which are available commercially, they make the water just like distilled water, and that is also good for our health. So the water should be just like groundwater but with less salt. So not all groundwaters are bad. In some areas you see there are more iron and all these things, very bad groundwater.
Right.
In some areas they mix up spring water or river water along with groundwater and then supply. So that's a very good choice. So they are giving your minerals also and clean water also. Okay. So the previously we used to use all these filters. There are candles.
Right. Yes.
These candles were in a way that is better than whatever filters we are making. I am not taking the name of these companies, but all these things are bad. Nowadays, what is commercially coming up.
Interesting.
Yeah.
Okay, so which means
that means our drinking water should not be free of minerals. It should have some minerals. That minerals are essential for our body.
Okay. Which means a little excess of that can actually cause.
Yes.
Okay. All right. I think I've learned a lot.
Thank you.
about kidney stones, but I'm pretty sure a lot of viewers out there also must be having or still have questions regarding the could be treatment, could be anything else related to the matter. But I would just leave your contacts and your contact details. Maybe they can get in touch with you for any problem consultations. The parlok nandu basedangi yo manikiran mane lada dalam tek jongpi ki babun. Bala saya kam siam stam kniat ban manikiran tingi bu ini video ki berit pat ki bangi la ban irap ban translate pi kanang ma pi la ma kham stu kham shai tikani kadai shpang jong ki kidney ki jongi kita ki ombai kini ki khlai jongi ki ba ya ling ba ka jabo pa ka ba ya saka jeng shabar jongi tibat kini ki ban yarap ya phi ban yo ya kamet ka bukoj bakhya bala da phi bakla le phi shim ya ki rai ki bakla la kalong kabam kadi ni ki lifestyle ki jong phi kala ban kata kala ban pen kosbi kita ki mau ha ki khlai doctor, just to be, I mean, again, this is out of curiosity, because I've heard this conversation regarding the gallbladder stone and the kidney stone, and what is the difference between the two, and how severe can either one of these cases can
Gallstones
cause.
are different. Gallstones are related to the liver.
Right.
Gallstones are stones formed in the bile within a gallbladder.
Yeah.
Kidney stones are completely different. The composition of both the stones are completely different. The treatment procedure is also different.
Different, right.
Gallstones are being treated by laparoscopic surgery. And gallstones, once a gallstone is formed, that should be operated. And that treatment is done by the general surgeon, not the urologist.
I
Kidney
see.
stones are treated by urologist, but not all kidney stones should be operated. That's my message.
All right. Okay. Ngatray, I think we have heard enough, and that's a lot of information in just one sitting. But I am pretty sure that there are hundreds and thousands of questions if we dig into the detail of things, and it won't be sufficient just one sitting to know it all.
Sure.
But again, if there's any other query that you have, feel free to reach out to a doctor and his clinic there in Guwahati. We'll put some of the contact information
Yes.
of the clinic where you can have access and contact and consult Dr. Joy here directly. And also feel free to also visit the clinic there in Christian
Basti, GS Road, just by the side of the Apollo Hospital, it's Supreme Tower. Just you Google Gauhati Urology Center, and there is number will come up. Just Google Gauhati Urology Center. That's all.
And I think I'll just leave the
Phone numbers also.
phone numbers and
the
the
contact
location.
number are there. Yeah.
The location also. I
Always
think.
come after contacting, after having. Yeah.
All right. So just tell us a little bit about the center, doctor. Do you also have? Can people also come and then get the treatment from your clinic itself?
Yeah,
or
definitely. I first evaluate all our patients in our clinic,
Okay.
and whether they actually need surgery or not. Because 80% don't need any surgery, and I send them off by giving advice. Or 20% of kidney stones they need treatment and surgery. Then I perform surgery wherever they can feel comfortable.
Okay.
Because
So
there are many poor patients also who cannot afford larger hospitals, bigger hospitals.
okay. So
Some patients
treatment
have-
you do
yeah.
it in other hospitals.
Other hospitals, in smaller hospitals. And I go to 8 to 9 hospitals in Guwahati. Out of the Hayat Hospital, Dispur Polyclinic, Dispur Hospital, Health City, Apollo Excel Care, all these are hospitals which I am going. And St. John Hospital. The best for me is who are poor people, I operate in St. John Hospital. There is one Christian hospital there, which is trust run hospital. That is St. John.
Okay.
So we
okay.
have the laser facility also for kidney stone. So for poor patients, we prefer to do surgery. There is a clean hospital. And
So which means you don't admit patients in your clinic, but you.
I don't
you
admit
would-
patients in my clinic unless it's very small stone or that's need just small treatment.
All right. Okay. So you would advise them or refer them
Yeah,
to
yes.
other hospitals.
Yeah.
Okay.
I take them to other hospitals and operate because not all patients can afford bigger hospitals.
Right.
But it's a different. The price varies too much. In somewhere it is 2 lakhs, somewhere it takes 60,000. So it varies too much.
All right. So it depends
Not
from
all
hospital
our
to
patients can afford all this.
depends on the facilities.
So
and
much
everything.
variation. Yeah, bigger hospitals, smaller hospitals, and all these things happen.
Okay. So for the ones who are planning to avail these treatment,
They must come after having this appointment
okay.
from the numbers given in Gauhati Urology Center, and that is available on website. And you also give this number. here.
Yes. So which means do they have to consult regarding the charges, the fee? All
Yeah,
the
everything will
treatment?
be. We have all. We have accommodated all sorts of patients. I have already told you.
Yeah.
There are rich patients, poor patients, all sorts of patients used to come. The patients who can't afford at all, only Ayushman, so they can also, we can afford. No issues.
Right. Okay, so I think let's end with this, doctor. Maybe your advice to young people and also to elderly people out there, if you can just put it in 3 to 5 things that people should do to lead a healthy lifestyle or a healthy kidney.
Avoid too much protein intake.
Mm-hmm.
Avoid extra protein supplement. Moderation on red meat, not too much red meat. Take natural protein instead, such as eggs and all this chana. These are good. And take little bit more water and be vigilant. Your urine color, and get one ultrasound every year of the kidneys. That's all.
All right. Thank you so much, doctor.
Thank you.
Thank you so much. It has been a very, very wonderful conversation. I feel like there's still I'm still trying to find questions in the back of my mind. What if I missed something? What if the viewers would still like to ask a few of the questions? But I'll leave that to doctor himself. You can consult. You can contact him directly. And if there's anyone of you or maybe your relative who are facing similar problems, you can contact doctor directly. So thank you so much for watching. And also we do have a secondary channel called Ha Shillong Clips, where we upload these short conversations, 4 to 5 minutes conversation from this long episode from here, where you can actually watch and share with your loved ones. We are also on Instagram for short videos where you can also share with your loved ones and get all the information in just about a minute or so. So thank you so much for tuning in. Kanikadi Ha Shillong, top of the town. See you in the next episode. Good night. Thanks so much, doctor.
Thanks.
Thanks so much, doctor. All right.
Long talk.